This is Lucy Sullivan interviewing Sharyn Katz on November 7th, 2013. So, Sharyn, name where and when you received your credentials, and where do you currently work?
I received my credentials in 1970. My registry number is 154. I am currently employed at Montefiore Medical Center, which is the University Hospital of the Albert Einstein Medical College in Bronx, New York.
What drew you to EEG and diagnostics?
Well, right out of high school, I was working, I was doing a work-study program, actually when I was a senior in high school, and I knew that I was interested in the allied health professions. And during my work-study program, I was working at the time in Philadelphia and became friendly with a woman who was working in the newly developed EEG lab at the Wills Eye Hospital in Philadelphia. That was a very prominent ophthalmology hospital, but they put in an EEG lab there. So on my lunch break, I would sit with her every day and watch her do EEGs, and became really interested in the technology and then the science of the brain. So I then decided that this would be the path in the allied health field that I would take, and I learned that there were two training programs in Philadelphia. One was a more formal program. I should mention that this was back in 1964, and one was at the Jefferson Hospital in Philadelphia, which had a formal structured program with real didactic work and practicum included. And then there was a non-structured training program at the Graduate Hospital, which was part of the University of Pennsylvania. I called both places to find out about their programs, and the more formal program at Jefferson Hospital was filled. And when I called the Graduate Hospital to find out about their program, they said, well, we have a position open for a secretary, and we always train our secretaries to do EEGs. Would you be interested? And so I said yes, and interviewed for the position and was hired on the spot. And my medical director was Daniel Silverman, and my supervisor was Theda Sanet.
Was EEG a popular specialty when you were starting your career?
No, it wasn't. It was very new technology, and there were very few hospitals that had EEG labs in them.
Who were your early mentors?
My earliest mentors were Dan Silverman, Dr. Daniel Silverman, and Theda Sanet, and Richard Harner.
What were your earliest career influences?
I suppose I was most influenced by the people that I worked with. Theda Sanet certainly was a wonderful mentor, and she and Dr. Silverman, and then when Dr. Harner came on board as chair of neurology and then oversaw the EEG department, they were very, very committed to quality and professionalism, and they set the bar very high for those people that worked with them. I grew to love the neurosciences, and it was just great to be part of that team. We were, in the early days, actually, Theda was the one that wrote the sort of definitive article on the 1020 system, and Lucy, if you look back at the old journals, the picture she has of actually measuring a head, that was me. The live head that she used was me in the early 60s when I was just a baby. I was still in diapers, I think. So it was very cool. I always say that I'm very, very lucky to have fallen into this opportunity, and I was able to take advantage of what they had to offer. So I feel very fortunate about that.
If you had not become an EEG technologist, what would you have liked to have done?
I might have become a marine biologist or a botanist. I find that very interesting. I still find it very interesting. I say that I'll do that in my next life. But had I been maybe better groomed both in high school and by my family, I may have chosen the path of medicine and become a doctor. It just wasn't so popular for women to go into medicine in the early and mid-'60s, although I do have lots of friends that I grew up with that are physicians, but it just wasn't the most popular thing when I was growing up, or at least not in my group of friends among my contemporaries. So.
Why do you think the field took off when and how it did?
I think that the field took off because there were lots of physicians, maybe not lots, but there was a core of physicians throughout the country that were very dedicated to the science and seeing that that EEG procedures were done correctly. And that core of physicians, along with the handful of technologists that worked with them, were the people that set the standards early on, set the bar for this to become a real profession, and worked very hard at making sure that EEG technology was recognized as a quality science. And so I think that, back in when I became involved in the early 60s, that was the motivation. I remember Dan Silverman used to train all of the technicians that were working at various hospitals. So in Philadelphia, there are lots of hospitals and many medical schools, but there were very few electroencephalographers at that time. And Dan Silverman was reading EEGs for probably 5 or 6 hospitals within the Philadelphia area. And I think it was every Wednesday, he had all of those technicians come to Graduate Hospital, and over lunch he did a training session. And it was mandatory. It wasn't even a question whether you were going to go or not. You went because you knew it was important. He made you feel very special, and he and Theta did such a good job at building your ego and making you feel important and making you feel like you were really contributing to the profession, that it was like a no-brainer. You just did it because you loved it. You loved being with them, and you loved sharing the experience with all the other people in the Philadelphia area. It was just a great time. At least for me, it was a great time.
What equipment did you train on, and what were the main limitations of it?
No. Well, I grew up in the grass era, and I think that the first machine I used was a 6-channel grass instrument. It was a wet cell battery. We had a grass EEG instrument, and we had an Oxford Metalog EEG machine, which was billed as the portable EEG, but it came in these 2 big, heavy suitcase-like things, and we had that built into a cart that we used in the lab. And when we had to go to the bedside to do an EEG with either one of those pieces of equipment, that was really hard because you were pushing these very heavy pieces of equipment on and off elevators. And in the days of wet batteries, there was always some saline leakage, from the well that the battery sat in, and you were always popping out a tube or a resistor or something was always off kilter, and so you had to spend sometimes hours realigning everything at the bedside before you could even start recording. So it was the time of hard knocks, I guess, in my early experience. And so I trained on grass instruments, and then of course graduate being sort of the graduate hospital being the forefront in technology. We went from a grass model 6 to a grass model 8 to a grass model 10 to a grass model 18 and 18 channel. So we went from model 4, 6, 8, and I think there was a grass model 10. I can't remember so well anymore. But so I used all of those analog EEG instruments, and then we got a Nihon Koden EEG machine. I guess it was an 18-channel Nihon Koden, and we used that for a while. We only had one of those, and the other 3 or 4 or 5 instruments were all grass. And then when Michael Sperling had taken over the EEG lab and the epilepsy monitoring unit at Graduate and Penn, he was very instrumental in moving the lab to an all-digital lab, which we thought, the staff, Theta was very progressive, and she said, this will be great, exciting, we're going to learn so much, it's new technology, how exciting. And the rest of us were all moaning and groaning because we were so used to the analog paper, and we felt so much more in control of everything. So Mike Sperling was the one that moved us into the next century of EEG equipment, and we used biologic instruments, and I currently use XLTech digital EEG.
What memories do you have of your training program?
I've mentioned a lot of them. I remember the weekly training sessions with Dr. Silverman and Theta. I remember the weekend training sessions at Dr. Silverman's house, where we would go and prepare for our boards, because there was no question that we weren't going to take boards. It was just a matter of when we were going to take them. And so he tried to be sure that all of us took them within within the same time frame. So every Saturday he would invite us for lunch, and we would do 2 or 3 hours of studying and review. Those were some of my very early memories. I remember the early days when the Philadelphia Regional EEG Technicians Society was active in the Philadelphia region, and I became involved in that. And then the Eastern EEG Technicians Association, which included the New York, New Jersey, Philadelphia area. So when I became involved in those 2 organizations, it just fulfilled me professionally, and I made lots of friends, and certainly I became a member of ASSET probably in '64 when I started working and training at Graduate Hospital. But I actually was working as the secretary and doing EEGs when somebody was out sick or they needed another person to do something. So those are some of my early memories.
What are the main ways in which the field has changed over your career?
Well, one, I think that we've become very, very professional. I think that we are on par with every other allied health organization and maybe exceed some of those those other technologists in the allied health fields. I think the other thing was the change from analog to digital EEG. I used to say, well, I still say it, that the EEG used to be as good as when you were recording with analog equipment, that the EEG was as good as the technologist recording the EEG. But now I think the EEG is as good as the person interpreting the EEG. And I say that because we can have people that have good skills at measuring heads, applying electrodes, having good impedances, and I can tell my staff, I want you to put on 100 electrodes on the head, and the impedances have to be perfect. But they don't have to try to necessarily plot a spike focus. It's the physician that needs to look at that data and see how he can change it to accomplish what he has set out to, look at. I just think that we could do that, although I don't like the idea that we have maybe taken away some of the independent thought processes of the technologists because of digital technology.
How has scientific knowledge changed the field, and what do you think were the big breakthroughs?
I guess maybe I answered it that way. From analog to digital, I think that the CT and MRI technology changed what we do in neurodiagnostics, because many years ago we did EEGs on anybody that had a headache. We don't do that anymore. We don't do EEGs so frequently on patients that have structural lesions, unless those structural lesions cause seizures in some way, or those structural lesions cause a change in their mental status, or somebody's in coma. So I think that a large part of what affected EEG technology was the information physicians could get from the CT and the MRI, and I think that the EEG is used most appropriately now for what it's meant to do, and that is looking for irritative focus and assessing levels of consciousness.
What are the 2 to 3 big issues in EEG that people are working on to solve today?
Well, in terms of the technology, I'm not so sure that I know that answer. When I look at ASSET as a profession, or those people that are in neurodiagnostics, I think that we still struggle to present ourselves as well-trained, well-educated professionals. I still think that there's some stigma that we don't have the skill sets that some of the other allied health professions have. But I'm not sure what other issues there might be.
What are the main areas of professional discussion or disagreement today?
Yeah, I'm not sure that I understand that question totally, so I don't have a real response to that.
What are you most proud of in your professional life?
Oh my gosh, I think everything. I think I feel best when I'm teaching and demonstrating and doing practical applications with my staff. I get great satisfaction every time somebody has been inspired to take their boards and really feel wonderful when they pass them. And I've been proud of my affiliation with ASSET and the role that I've played in ASSET in the early years, and now again in my later years. ASSET's come such a long way, and I've been very, very proud to be part of that growth since really I was a kid when I started. I'm not such a kid anymore, and I feel really good about everything that I've had some impact on, whether it was a big influence or a little one. I feel really good about that.
Where do you see neurodiagnostics in 10 years?
I don't know. The people that I work with here are having me put on, 100 electrodes and doing all kinds of interesting plotting when it comes to EEG. We're now looking at getting, I've forgotten the name of the machine, that does 256 electrode points and doing that. So I don't know. It's getting fancier and more technical, and I don't know where we'll be in 10 years, only that I think I'll probably be retired in 10 years.
What's the best piece of advice that you've ever received?
Well, I've received a lot of advice from my good friend and mentor, Theda Sanet. And one of the things that she said to me when I was actually new in the profession as a manager, and I would be frustrated about feeling that I needed to know every single thing and do every single thing. And she said to me that you can't know everything. You can't do everything. So she said, surround yourself with those people that can help you meet your objective. And it was great advice. And the other thing that she always used to say, which really is a warm, fuzzy feeling to me, is that be an appreciator. Be an appreciator of the arts. Be an appreciator of your colleagues. Be an appreciator of things that happen in life. And so that was her favorite. If you would ask Theda, do you like art? Can you play an instrument? She'd say, no, but I'm an appreciator. It was like the perfect response. And so when people ask me questions now, I say, like my friend Theda would say, I'm an appreciator. So I thought that was really great advice.
Is there anyone else in EEG that you think we should be interviewing and talking to?
I don't know. I think maybe Dick Harner. He was, and maybe I don't know all of the facts, but when he started in Philadelphia at Penn and Graduate Hospital, he was very into adapting computer technology to the assessment of brainwaves and how a computer could actually detect a normal from an abnormal EEG. And he's gone through probably many iterations of programs that can do that kind of thing. He also was one of the people that when he was chairman of ABRET, I used to be frustrated because he said that ABRET only tested for minimal competence. And I thought, how could that be? I feel so empowered by my knowledge, having passed this exam. And he said, no, we're only testing minimal competencies. And he said, it's wonderful that you can exceed beyond that. He said, but that's all ABRET does. And so I think that he had a perspective on the field that should be, he should be talked to about it. He was very bright. I think he came out of a residency program to become chairman of neurology at Graduate Hospital and really took the epilepsy piece of it and grew it. He, along with Theda, and so I would consider speaking to him. But there were a lot of people that I had, I guess, have influenced me in some way back in the really early years. And so one was Dr. Harner, but the other was Dr. Silverman. And I remember when he wrote, Dr. Silverman was the one that published the article on 14 and 6 per second positive spikes and then phantom spike waves. We were always helping him get samples for his papers or presentations. So I was always involved in that. And there's some interesting history about him. He came to the profession when he was in the service, but he was a psychoanalyst. And so he brought a different perspective to EEG. And people like Chuck Henry and John Knott Eli Goldenson, who was chair or who ran the EEG labs at Penn, University of Pennsylvania Hospital, and then later at Columbia in New York, and then actually here at Albert Einstein Medical College. And he has that book out. I forget who he wrote that with, but it's all samples of EEG. And while it's an old book, it's still a good reference book. People like Faye Tyner that have been, she had written that book with John that people are still using. So I don't know. Though I remember back in the early 60s, before I was actually working full-time as an EEG technician and doing EEGs and being the secretary of the department, and the American EEG Society, it was called the American EEG Society at the time, had the boards in Philadelphia for the physicians. And so Dr. Silverman, who was my medical director at the time, said to me, I need you to work and you have to help, because at the time the doctors had to do a patient. They had to measure a head, put electrodes on, and run a record. And he said to me, I want you to, work that weekend if you don't mind and help turn the labs around, blah, blah, blah. And then at the end of the session on Sunday, he said to me, okay, here are all the score sheets. Could you add them up and let us know who passed? And they went, and this whole group of people went off to dinner someplace in Philadelphia. And I went, oh, my God, I don't even have a calculator. And I remember sitting there figuring this all out and sweating, and then Dr. Silverman said to me, and when you're finished, just bring it over to us. We'll be at whatever restaurant it was. And I took it over, and people like Don Class, Reggie Bickford, Eli Goldenson, John Knott, Chuck Henry, Sam Little were all in this room, and I was like, my mouth just dropped, because these were names that I had seen on papers that I had read, articles that I had read, things that I had studied. And it was like so awe-inspiring. So all of those early people, I think, are worth looking into and getting some history in some way from them. I guess we have lots of history on John Knott and maybe Chuck Henry too. But I don't know about Reggie Bickford. I remember Reggie Bickford was way into, this was back in 66, was very into evoked potentials, and he went to, in South Street in Philadelphia was sort of the quote hippie, the hippies area in Philadelphia, and he went into one of these psychedelic shops, and he bought this pattern board that he said, I'm going to use this for evoked potentials. And I mean, it was just, when I look back at it and I think about it, I went, oh my God, here are the people that wrote all these articles and did all of this research and clinical application of stuff, and they were buying pattern recognition things in Philadelphia at the psychedelic shop. And so, I don't know, they were good years. I'd love to capture them again, but I don't know that that'll ever happen. I don't think that it's like it used to be so many years ago, and maybe it was just unique to our area. It was the Philadelphia area. I don't know, or the presence of people like Theta Sanin and Dan Silverman and Dick Harner. It just was a hub for EEG technologists, and everybody called our lab when they needed information or needed something about EEG, whether they were setting up a lab, whether they were, I don't know, they needed to buy supplies, they wanted to know, how to do something. We were the phone call, we were the speed dial at the time. So they were really good years, and there were a lot of people that made those years very, very fruitful for the profession.
Did Dr. Silverman die a young man?
He did. He died a young man of a heart attack.
Really? I knew, all of a sudden, yeah.
Yeah,
wow.
and so I'm trying to remember. He died in probably, I took my boards in 70, So he died shortly after my boards. And if in today's world he never would have died because the technology has been so improved. But he had a bad heart, and I forget now what all it was. But he was at the Eastern Association EEG meetings where they'd go to Mont Tremblant every year. Do you remember that, Liz? They were held in Mont Tremblant every winter, and it was a great meeting. And Dan Silverman, once he had his heart attack, and he had his heart attack in Mont Tremblant, and then after that he was not allowed to ski. So he said, I'm not going to these meetings because I can't stand not being able to ski. And so he would send me and my husband, and do you know Terry Boyle?
No.
Terry Boyle and I worked together for a lot of years, so he would send me and Terry and our husbands to Mont Tremblant just because he couldn't go. And he paid for it out of his own pocket.
Wow.
He just wanted somebody to be there because he thought that they were such great meetings. And he was, he would pay for our trips to the asset meeting because the hospitals at the time were not giving budgets for travel. And so he would send me and Theda and Terry to wherever the meetings were.
Oh, that's wonderful.
He was very generous and very good about that kind of stuff. I don't know that people would do that kind of thing anymore, but he was a great guy, and he and Theda were a wonderful team. And then when Dick Harner came in, he and Dr. Silverman were so different, but it was such a good, stimulating academic atmosphere. I mean, it was wonderful. So I consider myself very lucky to have been part of that.
No, it sounds like it.
Yeah, it was good times. Good times. We used to get together. Theda was so good about it. She used to say to everybody on the weekends, no matter how much the lab changed, no matter who the medical director was at the time, she'd say, oh, why don't you just come over for dinner on Saturday night? And she'd do this elaborate meal for, I don't know, it could be anywhere from 2 to 4 to 20 people that would show up on Saturday night at her apartment, and she'd have dinner. And then Dick Harner would come over, and he'd play the flute or the piano, or these were good times.
That sounds like it.
They were good times.
Yeah, you guys enjoyed, each other's company outside of work and everything.
Yeah, we did. We were together like 24/7 and never got tired of it.
Yeah.
I used to be anxious to go back to work on Monday because it was so much fun. I mean, we worked hard and we studied hard, and we towed the line, but it was wonderful. It was wonderful. So.
Sounds like it.
Yeah. That's all I can say in a nutshell, I guess.
Oh, no, it's great. This is great information. So I'll go ahead and just turn off the recording, and I'll be back in just a second.
Okay.